Inflammation is a complex biological response that our bodies use to protect and repair tissues after injury or infection. It typically begins with the dilation of blood vessels, allowing more blood to reach the affected area. This process is accompanied by fluid exudation, where fluid leaks into the tissues, and the migration of white blood cells, or leukocytes, to help fight off invaders. Fibrinogen, a protein involved in clotting, also accumulates. These changes peak within 6 to 8 hours. As healing progresses, blood flow returns to normal, and damaged cells are replaced, marking the transition from inflammation to tissue repair. Different types of cells play unique roles during inflammation. Monocytes and macrophages are responsible for clearing away dead tissue, essentially cleaning up the site of injury. Polymorphonuclear cells, or polymorphs, are specialized in destroying bacteria, helping to prevent infection. Lymphocytes, another type of white blood cell, are crucial for the formation of scar tissue, which helps restore the integrity of the affected area. Together, these cells coordinate the body's defense and repair mechanisms, ensuring that healing proceeds efficiently and effectively. Edema refers to the accumulation of excess fluid in body tissues, leading to noticeable swelling. This can occur for several reasons, such as increased permeability of capillaries, which allows more fluid to escape into the surrounding tissue. Other causes include increased capillary pressure, problems with kidney function, a reduction in plasma proteins, or as a direct result of inflammation. Edema is not just a symptom, but also a clue to underlying processes affecting the body, especially when it appears around sensitive areas like the eyelids. Eyelid edema, or swelling of the eyelids, can be triggered by a variety of factors. Inflammatory conditions like blepharitis and conjunctivitis are common culprits, as are allergic reactions and physical trauma. Systemic diseases, such as those affecting the kidneys or heart, can also lead to eyelid swelling. Even insect bites may cause localized edema. Recognizing the underlying cause is crucial for effective treatment, as each scenario may require a different approach to management and care. When it comes to treating eyelid edema, the approach depends on the underlying cause. For inflammatory or allergic swelling, systemic corticosteroids such as hydrocortisone or prednisolone are often prescribed to reduce inflammation and promote healing. These medications help control the body's immune response, minimizing tissue damage and discomfort. However, it's important to use these treatments under medical supervision, as improper use can lead to side effects or complications. Blepharitis is a chronic inflammation of the eyelid margins, often resulting from poor eyelid hygiene or infection. There are two main types: squamous, which involves flaky skin, and ulcerative, which can cause sores along the eyelid. Symptoms include redness, irritation, and sometimes crusting at the base of the eyelashes. Managing blepharitis typically involves regular cleaning of the eyelids and, in some cases, antibiotic treatment to address underlying infection. Styes, chalazion, and internal hordeolum are all infections of the eyelid glands. Styes are typically painful, red lumps near the edge of the eyelid, caused by bacterial infection. Chalazion is a blocked gland that forms a firm, painless lump, while internal hordeolum is an infection deeper within the eyelid. Treatment may involve warm compresses, antibiotics, or, in persistent cases, surgical incision or excision to drain the swelling and promote healing. Trachoma is a chronic, contagious eye disease caused by the bacterium Chlamydia trachomatis. It begins with follicular inflammation of the conjunctiva and can progress to scarring of the eyelid. If left untreated, complications like trichiasis, where eyelashes turn inward, and even blindness can occur. Preventing trachoma relies on good hygiene, early diagnosis, and prompt treatment with antibiotics. In advanced cases, surgical intervention may be necessary to prevent vision loss. Diagnosing infectious and inflammatory eyelid conditions often relies on clinical signs observed during an eye examination. Treatments include antibiotics such as sulfacetamide, tetracycline, or erythromycin, which target bacterial infections. Maintaining good eyelid hygiene is essential to prevent recurrence. In some cases, surgical interventions may be required to address complications or persistent infections, ensuring the best possible outcome for the patient. Ophthalmia neonatorum is a form of conjunctivitis that affects newborns, usually within the first few days of life. It can be caused by bacteria acquired during birth. Prevention is key, with prophylactic antibiotic drops or ointment applied to the eyes shortly after delivery. If infection occurs, prompt treatment and strict hygiene measures are necessary to prevent complications and protect the infant's vision. A black eye, or ecchymosis, results from trauma to the area around the eye, causing blood to collect under the skin and create a dark discoloration. Immediate treatment involves applying a cold compress to reduce swelling, followed by warm compresses after a day or two to promote healing. Most black eyes resolve on their own, but it's important to monitor for signs of more serious injury, such as vision changes or severe pain. Conditions like trichiasis, entropion, and ectropion involve mispositioned eyelashes or eyelids. Trichiasis occurs when eyelashes grow inward, irritating the eye. Entropion is the inward turning of the eyelid, while ectropion is the outward turning. These issues can cause discomfort, tearing, and even damage to the eye surface. Treatment options include surgical correction or epilation, which is the removal of misdirected lashes. Symbolpharon refers to adhesions between the eyelid and the conjunctiva, the membrane covering the white of the eye. These adhesions can restrict eye movement and cause discomfort. Prevention involves the use of ointments to keep tissues moist and separated, while established cases may require surgical treatment with mucous membrane grafts to restore normal function and comfort. Lagophthalmos is the inability to fully close the eyelids, while blepharospasm is an involuntary spasm of the eyelid muscles. Both conditions can lead to exposure and irritation of the eye surface. Management focuses on addressing the underlying cause, protecting the eye with lubricants or shields, and, if necessary, surgical correction to restore normal eyelid function. Ptosis is the medical term for drooping of the upper eyelid. This condition can affect one or both eyes and may be present at birth or develop later in life. Ptosis can interfere with vision if severe. The primary treatment is surgical correction, which lifts the eyelid to a normal position, improving both appearance and function. Most eyelid tumors are benign, meaning they are not cancerous. Common examples include nevi, which are moles, and papillomas, which are wart-like growths. Although these tumors are usually harmless, complete surgical excision is recommended to prevent recurrence and to rule out the rare possibility of malignant transformation. Regular monitoring and prompt removal are key to maintaining eyelid health. Let's visualize the process of inflammation in the eyelid. It starts with vascular dilation, followed by fluid exudation, leukocyte migration, and fibrinogen accumulation. This sequence peaks within 6 to 8 hours, after which the repair phase begins, restoring normal blood flow and cell turnover. To better understand edema, imagine fluid building up in the eyelid tissue due to increased capillary permeability or pressure. This schematic will highlight how fluid escapes from the blood vessels and accumulates, resulting in visible swelling. Several infections can affect the eyelids, each with distinct features. Blepharitis is a chronic inflammation, while styes and chalazion are gland infections presenting as lumps. Trachoma is a contagious disease with serious complications. Recognizing the differences helps in choosing the right treatment and preventing complications. Eyelid tumors are mostly benign, with nevi and papillomas being the most common. Malignant transformation is rare but possible, so complete excision is recommended. Early detection and removal are essential for the best outcomes. In summary, eyelid inflammation and related conditions involve a range of processes, from vascular changes and edema to infections and tumors. Early recognition, proper hygiene, and timely medical or surgical intervention are key to effective management. By understanding the causes and treatments, we can better protect our eye health and prevent complications.